When the seas are calm, shorelines and bordering lands are free from serious damage. But in the presence of strong waves, the shoreline is weakened and serious damage can occur. Like the beaches that are damaged by strong waves, our stomachs can be harmed by strong digestive juices that can weaken the stomach lining. Our stomachs have a protective mucus layer that allows food to be digested by strong digestive juices. Without this protective layer, these digestive juices could damage our stomachs. And if the protective layer becomes weakened for any reason, stomach ulcers could occur. In some cases, these ulcers could result in serious complications, such as bleeding, hospitalization, or surgery. Your doctor believes that you are in a class of patients at high risk for developing an ulcer or a complication from an ulcer from your arthritis medicine. Cytotec, also known as Misoprostol, has been prescribed for you by your doctor to help prevent stomach ulcers that may occur in some patients taking certain types of arthritis medicines. These medicines are called non-steroidal anti-inflammatory drugs. They include the prescription that your doctor has given you, as well as ibuprofen and aspirin. These medicines are prescribed for all types of arthritis to help decrease pain and swelling in the joints, allowing you to enjoy life more fully. Arthritis medicines can be very helpful in decreasing pain and swelling in your joints. But like every medicine, they can also cause unwanted side effects. Some side effects are simply annoying, such as stomach upset. Others can be more serious, such as stomach ulcers. It has to do with prostaglandins.
Prostaglandins are natural substances present in many parts of the body. Prostaglandins can have many different effects. Sometimes these effects are not wanted. For example, patients with arthritis have too high a level of prostaglandins in their joints. This is partly responsible for the pain, redness, and swelling, the common symptoms of arthritis. On the other hand, they are thought to help control the amount of acid in your stomach, as well as the thickness of the mucus lining of the stomach.
The arthritis medicine you are taking has a good effect by helping to relieve your arthritis symptoms. It does this in part by decreasing the amount of prostaglandins in your arthritic joints. However, the arthritis medicine can also decrease the amount of prostaglandins in the lining of your stomach. If there are not enough prostaglandins in your stomach lining, your stomach cannot protect itself from these acids, and you could develop a stomach ulcer. In some cases, these ulcers could become serious, resulting in bleeding, hospitalization, or surgery. Cytotec, a man-made prostaglandin, has been proven to help prevent stomach ulcers in certain patients who are taking arthritis medicines.
By increasing the amount of prostaglandins in the stomach, Cytotec helps defend against stomach ulcers by decreasing the amount of acid the stomach makes, and also by building up a thick layer of mucus in the stomach lining to protect it from these digestive acids. Just like a strong seawall helps to protect a beach from serious damage, Cytotec helps to strengthen your stomach's mucus lining. And as a gentle rain is less damaging than a strong one, Cytotec decreases the amount of acid the stomach makes.
Fortunately, not all people develop problems when they're taking arthritis medicines, but there are 3 groups who are at high risk.
Patients whose bodies are already weakened by other serious medical problems may find it more difficult to recover from the complications of a stomach ulcer. The ability of the stomach lining to protect itself may decrease with age, making it more difficult for certain older people to recover from an ulcer and its serious complications. Lastly, patients who have had a previous ulcer have a higher chance of developing another ulcer when taking certain arthritis medicines.
Now that you understand why your doctor has prescribed Cytotec for you, it is important for you to know how to take it correctly. You are the single most important person in your treatment.
It is very important that you take each Cytotec tablet with a meal. If you've been prescribed a dose at bedtime, be sure to remember to take it with a snack. The reason Cytotec must be taken with food is to decrease the chance of developing diarrhea. Diarrhea commonly occurs during the first weeks of treatment because the body is adjusting to the medicine. Remembering to take each dose of Cytotec with food will help decrease diarrhea. Even if you take each dose of Cytotec with food, you could still develop diarrhea when starting the medicine. The most important point to remember is to keep taking Cytotec. For most patients, the diarrhea usually goes away on its own within 3 to 8 days without any further problems. If you continue to have loose stools longer than 8 days, or if your diarrhea is explosive and you feel you're losing too much water, call your doctor.
Some patients may also develop bloating or stomach cramping. Like diarrhea, these symptoms should stop within 3 to 8 days after you start taking the medicine. If the symptoms become severe or last longer than 8 days, call your doctor. Sometimes arthritis medicines can cause stomach upset that has nothing to do with ulcers. Cytotec can help prevent stomach ulcers, but it may not relieve stomach upset. If you develop an upset stomach, your doctor may recommend that you take an antacid. Because certain antacids can cause diarrhea, ask your doctor before taking anti-antacid.
In order for Cytotec to protect you from stomach ulcers, you must take it for the full length of time that you are taking your non-steroidal arthritis medicine. Try not to miss any doses. Do not take Cytotec if you are pregnant or if there is any chance you could be pregnant. Furthermore, you should not become pregnant while taking Cytotec. If a woman is pregnant and takes Cytotec, she could have a miscarriage or dangerous bleeding. This could result in hospitalization, surgery, infertility, or death.
If you are a woman of childbearing age, you should talk with your doctor about the most effective form of contraception that you should follow during therapy. If you think you may be pregnant, stop taking Cytotec and contact your doctor immediately. Also, never share Cytotec with friends, neighbors, relatives, or anyone else. Keep Cytotec in its original bottle and store the bottle out of the reach of children. And if you have any questions or problems during treatment with Cytotec, do not hesitate to ask your doctor. Remember the most important points about your Cytotec therapy. Diarrhea, bloating, and stomach cramping are common side effects with Cytotec and usually go away on their own within 3 to 8 days. Don't make the mistake some patients have made by stopping the medicine at the first sign of diarrhea. Always take Cytotec with meals or a snack at bedtime as your doctor has prescribed, and never give the medicine to anyone else. Do not take Cytotec if you're pregnant or become pregnant, and if you have any questions or problems, call your doctor. By taking Cytotec, you're helping to protect your stomach from ulcers caused by certain arthritis medicines. Cytotec decreases the amount of acid your stomach produces and helps to strengthen the barrier of protection in your stomach, like calming a storm and building a protective barrier.
Please consult pages 12 and 13 of the accompanying patient information booklet. Your doctor has a complete prescribing information for Cytotec if you desire more information.